We have the power to prevent tragedies like children not growing to their full intellectual or physical potential because they've got a measles infection early in life. One of the tools that we have is creating a national vaccine registry. Canada is one of the only countries that doesn't have one of these. A registry would be somewhere where you could do the simple thing of looking up how many vaccines you got and when you got them. COVID made it pretty clear that we need a national vaccine registry. And in fact, we can build them at least in the provincial level. If you're looking to figure out if you got all your childhood vaccines or when your last flu shot was, it's really hard to do. A national registry would make that a lot easier. Right now, we're grappling with the measles becoming endemic in Canada. If we still have measles circulating this October, we're going to join a list of countries where people will be warned about coming to those countries without proper vaccination. Now, having a national vaccine registry isn't going to make that problem go away. We've got to deal with misinformation and the family doctor crisis, but it would help because some places look like almost nobody's vaccinated, or some schools look like really under-vaccinated, but they're not. They're just that those records aren't up to date. Of all the vaccines we have, the measles vaccine has saved the most lives. It's also one of the most contagious viruses we've ever had. And so this means that without having really high vaccination rates, it will spread. A national vaccine registry would be helpful because it would allow our public health units to focus resources where they're most needed and to help people catch up on those vaccines. As many Canadians move provinces, so if you got some of your vaccines outside of the province you're currently living in, it can be hard to get those sent back and forth. And of course, many Canadians will get some of their vaccines outside the country. And again, it's hard to get that documentation into our electronic medical records. Canada has some of the strongest personal privacy protections in the world, and that's a good thing. But it becomes a problem when you can't even access your own data to figure out if you've been vaccinated or not. Any registry we would make would have to respect our privacy legislation. But at the same time, we could create a system where a person could either opt out if they didn't want to be a part, or make it really clear who could have access to that data. When I was a young person, our vaccine documentation was a little yellow card. That card is lost to the winds of time. Having National Vaccine Registry would mean you could type in your health number and get all the information about all the vaccines you ever had, which would be a lot easier than cleaning up my junk drawer.